I'm Dr. Ken Landau. Let's talk about Onexton. Onexton is a topical anti-acne medicine that you see advertised on the television. It combines clindamycin phosphate, that's an antibiotic, and a benzoyl peroxide. Now in this case, specifically, the clindamycin phosphate is 1.2% and the benzoyl peroxide is 3.75%. Is there pure science behind those numbers, or is it a patent issue, a marketing issue, and a profit issue? I think probably the latter. Anyway, the drug, this particular one, was approved by the Food and Drug Administration in November of 2014. It was marketed as of early 2015, has a 10-week expiration date. The pharmacist keeps it refrigerated, but you don't have to. You put a pea-size amount on, you do that once a day, but it's a good idea not to be taking oral or topical erythromycin or clindamycin when you use this medicine. It combines a benzoyl peroxide and clindamycin phosphate. Now there are lots of medicines that are on the market that combine those two, and they have different percentages. But the benzoyl peroxide is a standard medicine. It's an oxidizing agent. It kills bacteria, and it acts to open the pores. It's keratolytic. So that's pretty good. Clindamycin phosphate is an antibiotic, and it works fairly well. It isn't the greatest medicine in the world. The benzoyl peroxide by itself, for mild to moderate acne, seems to clear about 50% of the people. If you have the inflammatory lesions, the papules and pustules, well, they are reduced in number by about 50% if you use the medicine for about 12 weeks. If you have the non-inflammatory lesions, the blackhead, whiteheads, probably also reduced by about 50%. You take the antibiotic, the topical antibiotic, if you're unresponsive to just the benzoyl peroxide alone. Now, do you get much better benefit if you use the Onexton that combines the benzoyl peroxide and the clindamycin phosphate? And the answer is no, it's all about the same. So if you have the inflammatory lesions, you improve them by about 50 to 60%, and the non-inflammatory lesions, well, somewhere around, again, 50 to 60%. The vehicle alone, if you use just a cream without any active ingredient at all, you improve by about half as much as you do with the active cream. And at 12 weeks, if we look at the likelihood that you'll be clear or almost completely clear with the Onexton, it's only about 25% versus about 12 or 13% with a placebo. So it would appear, interestingly, that because of hormones, these medicines are more effective in women than they are in men. But remember, if you use a benzoyl peroxide by itself, without the combination, you'll get probably almost, if not exactly the same benefit that you get when you use the Onexton. Are there side effects? Sure, there are side effects, but the side effects are relatively mild. So a benzoyl peroxide might cause some redness, burning, scaling, itching, dryness of the skin. It might cause some discoloration of the fabrics if it gets on your clothes, and then you might be able to get an allergy to using the drug. The topical clindamycin, well, that's an antibiotic, and people worry about diarrhea and colitis. Very, very rarely occurs. And certainly if you have a history of regional enteritis or ulcerative colitis, maybe you're a little bit extra careful. It's interesting that this drug, manufactured by a company known as Valiant Pharmaceuticals from Canada, well, they've been involved in an awful lot of mischief and mispricing and overpricing of drugs for the longest while. And they finally got caught, and their stock price has fallen dramatically because of all of the shenanigans that they've been up to. Well, you could go and buy a benzoyl peroxide, 5% or 10%, for less than $10. You could go and get, with a prescription, clindamycin, and benzoyl peroxide obviously is not a prescription. You could get a prescription for clindamycin, the topical medicine, for as low as $30. How much do you think it costs to buy a container of Onexton? Go over to the Walgreens or go over to the CVS and see how much it would cost. If you have no insurance, it will cost you about $530. Is it worth it? You know, I don't really think so. Anyway, that's something for you to consider. I'm Dr. Ken Landau.